Then finally, you know, no talk of viruses and rheumatic disease would be incomplete without talking about COVID-19 and rheumatic syndromes. And, this is the subject of literally thousands of articles now. And, if I had to summarize the relationship between COVID-19 and autoimmunity and IMIDs, and particularly rheumatic diseases, I think I would make a handful of points. I'd say, first of all, um, there is little evidence to date that COVID-19, particularly as it has evolved into a more benign disease, does little to alter the course of most rheumatic diseases. Now, that's a generalization, and there are exceptions at both ends. The second point, and I really think that this is the most important take-home message that I can give, is that the patients that we maintain on chronic B-cell depletion, with rituximab and other B-cell depleting agents, ANCA vasculitis, severe lupus, other disorders. These patients remain highly vulnerable to severe morbidity and mortality to COVID-19, even when the rest of us are thinking that this is turning into more like a mild respiratory infection. And these people need risk mitigation and they need prompt therapy. So that's the second point. Thirdly, it should be recognized that COVID-19 has produced a variety of inflammatory diseases that have rheumatic flavors. And that includes the multisystem inflammatory syndrome of children, which is a Kawasaki's-like disease that occurs in the wake of even resolved COVID-19, and multisystem inflammatory syndrome of adults, much rarer, but it is a cytokine release syndrome that occurs after COVID-19 has resolved. Then finally, there is a new syndrome of COVID-related MDA5 syndrome, a severe form of myositis with prominent dermatologic pulmonary disease with fatal complications. It's just recently been described in 2024, and there's a lot of excitement about this. We'll be talking about this at ACR and beyond. And then lastly, there's a great debate going on right now whether COVID-19 induces rheumatic diseases like rheumatoid arthritis, Sjogren's, and lupus. And all I can say is the data are far from clear. Stay tuned.